With the direct anterior, you come in directly in front of the hip compared to the posterior approach where you go directly posterior. It's made it a lot quicker for patients to get back to their normal routine. With direct anterior hip replacement, there's very little need for physical therapy after surgery. Most hip patients might use a walker or a cane for less than a week or two. Right after surgery, they're able to go up and down stairs, they're back walking. Also, in terms of their recovery, they have very little pain medication need based on the fact that the surgery was done through a less muscle damaging approach. I usually say most patients are candidate for direct anterior approach as long as we can safely plan the incision in front of the hip. 95% of the patients who see me will be candidates.